we're talking about keeping kids safe, and winter sports and keeping them safe is a big part of your job here. I mean, you see it after the fact, but tell me a little bit how we can keep our kids safe during these winter months of winter sports.
Well, probably the biggest accidents or injuries that we see in the winter time are sledding and snowboarding injuries. And so one of the biggest things that we'd recommend for anybody that sleds or snowboards is just to use common sense, not get over your head. Don't do things that are dangerous, basically. And especially snowboarders, there's a tendency, I think, for people to be a little bit more daring on snowboards. It's really important to wear a helmet. So many people fall and hit their heads, and so a lot of the injuries that we see with snowboarding are head injuries.
And that's from not wearing a helmet.
Exactly, yeah.
And people definitely need to take that into mind. Also, maybe wrist guards, because I know a lot of people break their wrists when snowboarding.
It's injury with snowboarding. It usually goes from here to here, and then your shoulders actually,
Really?
and then it's usually spine injuries.
Spine injuries.
We've seen broken necks, broken backs from snowboarding.
Wow. And so does it depend on the snow and the conditions for sure? Does that make a difference?
I don't know if it's necessarily the snow or the conditions. The big issue with snowboarding is just the nature and physics of the snowboard. You're on a board, and if it catches an edge, it usually will catapult you into the ground. And that velocity of that experience is really hard on everything: your head, your wrists, your shoulders, your neck, your back.
So do you see that the same amount with skiing as you do with snowboarding?
Oh, no. I bet you skiing is, we see probably 10 snowboarding injuries to 1 skiing injury.
Wow, that's a lot.
It's an awful lot.
And we were talking about tubing. And tubing is what keeps you guys rolling here in the ER.
Yeah, the big issue with tubing is Old Main Hill. You get a lot of young adults or teenagers, and they like to get in chains. If they hit a bump, then you've got 5, 6 bodies colliding with each other. Nobody wears a helmet when they sled. It's probably a really good idea to do it, but they hit their heads. No, they never do. They hit their heads, they land funny, they tweak their backs, they break their backs, they break their shoulders, their wrists. They hurt a lot.
Yeah, and so how many accidents do you see here in average in the winter time?
Usually more on the weekends, just because of the Saturdays and the Sundays people are going out, but we probably will see 4 to 10 on those weekend days.
That's a lot. Well, what could you recommend for families and keeping safe, and what sports would you recommend that they could do that were a little bit on the more safer side? I know that's a good question.
It's a difficult thing because snowboarding, we see a lot of snowboarding accidents, and it's just that the velocity of them catching their edge and hitting. I would never really discourage people from doing those kind of things, but a couple of things that would be a good idea to not get pulled behind vehicles on the road, because that's
one thing I did as a child, being pulled behind.
It's definitely fun when you're young because of the thrill and everything, but there are a lot of obstacles that you can hit, and there's other vehicles that can hit you, and that's obviously very dangerous.
Very dangerous. Tell me a little bit. I know you're a board certified ER. Tell me exactly what that is.
Now board certification requires you to complete a residency. That's usually 3 to 4 years long. And then when you complete the residency, in order to become board certified, you have to take an overall aptitude test. The aptitude test takes a day. There's usually an oral portion of that, which is a separate day. And now, once you pass that test, whereas you only had to usually take another test, they actually do lifelong learning assessments. So every year, for about a 5-year period before you retake the test, you have to study a variety of different magazine articles so that you're up to date on the newest and the latest.
Education.
Exactly.
And how does that set you apart from other doctors?
I think it's really good, and it's required now. In most bigger areas and urban areas, you can't work in an emergency department unless you're board certified. And to be board certified now, you have to be residency trained. It was that other specialties could actually grandfather into the profession, but now you have to complete a residency to be board certified.
And how far along are you on this? I know you're almost complete.
Well, I completed mine in '02, and I'm actually just in the process. I'll have to take my my second board examination on 2013.
Well, if you're in the ER, you will definitely see you as one of the doctors. So be careful out there with your winter sports, and keep in mind the wearing helmet is always a good thing, for sure.
Absolutely.
I appreciate you, Dr. Stolworthy. Thank you so much.